We've just held a fantastic two-day conference in Madrid where we have joined forces between the European Institute, IHD, and the EMIF project, a large big data IMI sponsored project. 2 days where we've really been looking at the value and uses of real-world data, that is data collected in routine ways in healthcare, and how we can use that to really improve healthcare and improve research. We have looked over these 2 days at how we can look especially at using data to learn more about the outcomes, the health outcomes and care outcomes of patients, and optimize health services and direct future research to improve the outcomes, the health of individuals, of patients and of society, people who are not yet ill. We've also looked at a really important issue, which is trustworthiness. How can we build an ecosystem in which the people who have collected health data, patients, professionals and others, and those who want to analyze and use, share, aggregate health data, can establish practices that are trusted by society so that they are willing to support those uses of their data? And how can we ensure that the purposes for which the health data are used are those that society really endorses? We've also looked, especially today in the second day of the conference, at state-of-the-art in big data research. How do we bring data together for analysis purposes whilst leaving the source data where it is in all of the different data sources and countries? And what can we learn? We've actually heard today about some really outstanding research in understanding metabolic diseases and Alzheimer's diseases, really scientific breakthroughs. These would have been impossible without the large multi-million volumes of data the EMIF project has been able to harness. This is absolutely fantastic. I'm really excited to see that we can use health data already at scale to learn things that were never learnable before. Society has to trust that when their data are used for research, for learning, for quality improvement, but in locations and by people who are not where they gave their data, outside the hospital, outside the GP, by a wider community, that their privacy is still protected and that their confidence in the trustworthiness of how that data will be used is guaranteed. So governance is absolutely critical to the success and acceptability of scaling up uses of health data. At our institute, we are really committed to this topic, and we have done a lot of work in the last few years growing governance instruments, codes of practice, assessment methods, examining software products to check that they have good, robust privacy protection. In EMIF, we've done also some fantastic good work on data sharing, looking at what should be the protections offered to data subjects and to data sources when they share data with a potential research user who wants to query the data and identify some new research findings. We know that the challenges and the opportunities from making better uses of health data have to be taken forward by multiple stakeholders working together. We have to co-create the solutions to the challenges, and we have to co-create value realization. So our institute, IHD, is deliberately and proactively multi-stakeholder. That's included in the way we've advertised our conference. And I am really delighted. We've had well over 200 people coming from all sorts of stakeholder communities, whether it's patients, hospital, GP, ICT, standards bodies, pharma industry, medtech industry, politicians, other stakeholders have all come together. And the atmosphere in the room during these presentations and discussions has shown that these individuals realize the only way forward is to work together. So I am really thrilled that we've helped to create that atmosphere, that understanding, and I look forward now to working with multiple stakeholders on our mission to make greater health data benefit of everyone. I'm really pleased that IHD is already starting to become recognised as an important player in the landscape, fulfilling a unique and vital role. We are perhaps the only real champion of health data itself as a concept, as something that has to be looked after, handled well, treated with care, but richly exploited for the benefit of all. And I believe the stakeholders that come to us are really excited and keen that we should take this on and work with them on it.